Hey guys, welcome back to Neuronify, and we are finally starting with day 3 of FMT series, and the topic is lead poisoning. So let's begin without wasting a single minute. Chemical name is plumbum, Pb, and chronic poisoning is called as plumbism, also Saturnism. Lead is heavy, soft, steel grey. It releases toxic fumes when melted, and children are more prone than adults due to high absorption and developing CNS. There are two forms of lead, organic lead and inorganic lead. In organic lead, tetraethyl lead, which is most toxic and is lipid soluble. It is used as anti-knock agent in petrol (MCQ). It causes severe CNS toxicity, which leads to encephalopathy. And in inorganic lead, these are nothing but salts. Most common salt is lead acetate, which is white acicular crystals. Lead tetroxide, which has scarlet crystals, and most toxic inorganic salt it is. Lead sulfide, which is used in eyeliner. Lead carbonate, which is white powder used in paint, and lead chromate, which is chrome yellow pigment, which has chrome yellow pigment. Talking about routes of exposure in children, oral ingestion, paint flecks, toys, soil, and in adults, inhalational, which is occupational, painters, battery workers, plumbers, and polishing industry. These are two routes of exposure, either ingestion or inhalation. Talking about absorption, distribution, and excretion of lead. Lead is absorbed from lungs more comparative to GI, and high absorption occurs in iron, calcium, and zinc deficiency people. It is also distributed to soft tissues like liver, kidney, and brain, and also bone, which leads to lead lime, which occurs due to long-term storage of lead. Excretion occurs via urine and bile. Moving ahead, mechanism of action. It is very important. It binds with sulfahydryl enzymes and inhibits cellular metabolism. The same mechanism, arsenic has the same mechanism. It binds with sulfahydryl enzymes and which inhibits cellular respiration, if you remember. Second is it inhibits the enzyme required for heme synthesis. And what are those enzymes? ALA dehydratase, ALA synthase, coporphyrinogen oxidase, and ferrochelatase. So these are microcytic. This leads to microcytic hypochromic anemia. Third, it causes hemolysis. It mimics calcium. It incorporates into bone and causes lead line. And direct neurotoxicity leads to wrist and foot drop, encephalopathy, which usually develops in children. This is nothing but the mechanism of action. Now let's see what is the exact pathway of heme synthesis. This is important for MCQ purpose. The very first thing is there is union of glycine and succinyl CoA, which leads to the formation of ALA, amino levulinic acid. And this further is converted into porphobilinogen, and porphobilinogen is further converted to protoporphyrin, which is added with iron by ferrochelatase, and then it is converted to heme. So what happens is lead inhibits ferrochelatase, because of which there is no insertion of iron and there is no formation of heme. Protoporphyrin gets accumulated inside the blood because of inhibition of ferrochelatase. And secondly, ALA dehydratase is also inhibited. It is not shown here, but glycine plus succinyl CoA leads to the formation of ALA, and ALA further leads to the formation of porphobilinogen. So the two enzymes are inhibited, ALA dehydratase and ferrochelatase. ALA dehydratase, which converts ALA to porphobilinogen. Here we can see that ALA is getting converted to porphobilinogen, and this is done by ALA dehydratase, which is also inhibited by lead. And you can see and you can think that if ALA dehydratase is inhibited, then obviously there would be accumulation of ALA in the body. Similarly, if ferrochelatase is inhibited by lead, then there would be accumulation of protoporphyrin. So if MCQ asks us that, if any of the question asks us that what would get accumulated inside the body due to lead, so the answer would be protoporphyrin and your ALA. Fine. So two key enzymes inhibited by lead are ALA dehydratase, which converts ALA to porphobilinogen, and ferrochelatase, which inserts the ion into protoporphyrin to form heme. So this is the image of lead line, dense metaphyseal bands, which are lead lines, which are seen bilaterally, blue colored in X-ray. Moving ahead and talking about the clinical features of lead poisoning. So the very easy mnemonic is ABCDEFG. Fine. A stands for anemia, which is microcytic hypochromic. It inhibits ALA dehydratase and ferrochelatase, because of which there is anemia. Obviously, if there is no heme synthesis, then there would be anemia. Second is B stands for Burtonian line, blue-black line at gingivodental margin due to lead sulfide deposition, and it is also seen in mercury, copper and iron poisoning. Again, B stands for basophilic stippling, punctate basophilia in RBCs. Basophilic stippling in simple words is the accumulation of degraded RNA inside the RBCs, and due to inhibition of pyrimidine 5 nucleotidase. See, pyrimidine 5 nucleotidase is an enzyme which is required to exit the degraded RNA out of the RBC. But since this enzyme is itself inhibited in lead poisoning, there would be simultaneously accumulation of degraded RNA, which leads to basophilic stippling in RBCs. Again, B stands for bone line or lead line, which is radiopaque metaphyseal bands in children. C stands for colic and constipation. It is also called as Pinter's colic, dry belly ache, severe nocturnal abdominal pain, cramps and tenesmus. D stands for drop, wrist drop or foot drop. Motor neuropathy leads to paralysis and lead palsy. E stands for encephalopathy, especially in children, vomiting, convulsions, irritability, ataxia, and in severe encephalopathy we observe cerebral edema, which leads to coma, and mainly due to tetraethyl lead. Tetraethyl lead is an organic lead, if you remember. F stands for facial pallor, especially circumoral pallor around the mouth, and due to vasospasm plus anemia, facial pallor occurs. And G stands for gout, which is saturnine gout due to impaired uric acid excretion. So there are certain signs and symptoms of lead poisoning in adults, which may include abdominal pain, headaches, memory loss, muscle weakness, pain, numbness or tingling of arms. So this is Burtonian line. We can see the grayish, we can see the arrow here. This is nothing but your Burtonian line. About Cabot rings, we'll see further. Talking about the laboratory findings, in peripheral smear we observe microcytic hypochromic anemia, basophilic stippling, anisocytosis, poikilocytosis and Cabot's ring. What are Cabot's ring? These are nothing but the mitotic spindles which are present in the RBCs. Abnormal condition it is. And what is anisocytosis? We know that different sizes of RBCs are present in the smear, and poikilocytosis, different shapes of RBCs are seen. So this is observed in peripheral smear. In radiology, you see lead line at metaphysis, dense band, and radio-opaque deposits in GIT, whole body lead burden on X-ray. And in blood and urine, you see increased blood lead level, increase free erythrocyte protoporphyrin and increase ALA in urine. Why? We know that because there is inhibition of ALA dehydratase and ferrochelatase. Moving ahead and talking about the management. In management, you can remove the source of exposure, you can remove patient from the environment, you can wash skin, decontaminate clothing, correct anemia and nutritional deficiencies by ensuring adequate iron, calcium, zinc intake. Chelation can be done, calcium disodium EDTA, which is best antidote for lead, BAL, British anti-levicide and DMSA, Saximo. In severe poisoning, EDTA alone cannot be used because it does not cross blood-brain barrier. Instead, we use BAL plus EDTA or DMSA plus EDTA. Talking about the autopsy findings, what we find pale skin, blue line on gums, which is Burtonian line, emaciation, lead line on metaphysis, X-ray, as we can see, GIT ulceration with contracted wall, renal tubular necrosis, bone marrow hyperplasia, and demyelination of peripheral nerves. So these are nothing but the autopsy findings which we find in lead poisoning. Pale skin, blue line on gums, emaciation, lead line on metaphysis, GIT ulceration with contracted wall, renal tubular necrosis, bone marrow hyperplasia, and demyelination. Medico-legal importance, common accidental poisoning in children, occupational poisoning in metal, paint, battery industries, rarely used for homicide and suicide. Lead bullet retained in body causes chronic toxicity. And lead-based pen flex is major public health hazard. So this is nothing but the medico-legal importance of lead poisoning. Now, this was all about lead poisoning. Let's get to the summary. Lead line in gums is called as Burtonian line. Lead line in bones is dense metaphyseal bands. Neuropathy leads to wrist drop. Most common pediatric manifestation is cognitive impairment in children. And what are the enzymes which are inhibited? ALA dehydratase and ferrochelatase. In urine finding, we get increased ALA amount. In blood finding, we get increase in free erythrocyte protoporphyrin. In peripheral smear, we get basophilic stippling. In severe poisoning, we give BAL plus EDTA because EDTA does not cross the blood-brain barrier. And in mild and moderate poisoning, we give Saxaima, which is DMSA. Saturnine gout refers to gout-like symptoms that occur as a result of chronic lead poisoning. Lead can interfere with the metabolism of uric acid, leading to elevated levels of uric acid in the blood, which can result in the deposition of urate crystals in joints, causing symptoms similar to gout. And so why it is called as Saturnine gout. And we know that lead poisoning is also called as Saturnism. Fine. Now we'll start with MCQs. Very first MCQ. A child living in an old painted house presents with cognitive decline and anemia, which abnormality is expected? Which lab abnormality is expected? Increased serum iron, increased ALA in urine, decreased ferritin, or hyperbilirubinemia. A child lives in an old painted house. Cognitive decline, anemia. So these are the symptoms of what? Obviously, lead poisoning. So what would be the right answer? Option B would be the right answer. Increased ALA in urine due to inhibition of which enzyme? It is ALA dehydratase. I think you people got it right. Moving ahead, basophilic stippling occurs due to inhibition of what? DNA synthesis, RNA degradation, protein synthesis, or ion absorption. It is nothing but accumulation of degraded RNA. So the correct answer is inhibition of RNA degradation, option B. A painter presents with wrist drop and microcytic anemia. Which investigation best supports diagnosis? Serum ceruloplasmin, urinary coporphyrin and ALA, serum cholinesterase, or blood cyanide level? I think it's pretty easy now. So the correct answer is urinary coporphyrin and ALA. Child with encephalopathy due to lead poisoning will most likely present with hyperreflexia only, seizures and cerebral edema, ascending paralysis, or hematemesis. So the correct answer is seizures and cerebral edema. A child with lead poisoning is treated with Saxaima. Saxaima is an oral chelator, antidote for cyanide, iron chelator, or a copper chelator. So the answer is oral chelator. Saxaima DMSA is an oral chelator. So this was it. And we have successfully completed lead poisoning, and I hope the people
keep
understood
learning,
this.
keep growing.
Don't forget to revise lead poisoning.